I currently work as a HemOnc nurse in an inpatient facility. HemOnc stands for Hematology and Oncology. I mostly deal and specialize in caring for blood-related illnesses, diseases, and disorders. Sickle cell anemia, when they are in crisis, leukemia, lymphoma, myeloma, cancers like skin cancers, lung cancer, prostate cancer, breast cancers, and many more. Being an oncology nurse means that I have to be competent with administering chemotherapy, cancer care, pre and post. There is a 36 inpatient bed in the unit where I work. Mostly half could potentially receive chemotherapy at the same time. Day nurses can have 4 patients each. Last shift chemo is highly risky. One nurse during the day will have 5 patients. This is typical. This is a rotation. During night shift where I work, it is a 4-to-1 ratio. If you are administering chemo, you will be capped at 4 all throughout the night. 3 non-chemo nurses will have to take 5 patients each. I normally arrive 15 to 30 minutes on my first of 3 days in a row. I do this so I can prepare mentally, look at my patients, treatment plan, plan of care, basically paint a picture of my patient in my head. 7 to 7:30 p.m. or longer, depends on the acuity of my assignment. I get a report from the day nurse. We do the handoff like PCAs, chemo, drips, bloods, drains, antibiotics, fluids, etc. This is also a good opportunity to introduce myself to the patient, give them time frames and what to expect. My usual line is, "Hello, my name is Ciara. I will be your nurse tonight until tomorrow at 7 a.m. Nurse Josh is leaving for the night. I'm just going to finish getting a report from my other patients. I will be back to do an assessment in MedPass if you have any. Please make sure you press the red button if you need assistance. Do you need anything at this time, or do you want me to bring something in the kitchen when I come back?" This is also a good opportunity to make sure that they can reach the call bell light and the bed is low. Bed alarm is on if necessary. Till 8 p.m. I try to read, review orders as fast as I can. From about 8 to 10 p.m., first med pass, quick physical assessment, my peripheral IVs, my fluids, my drains, Q4 neuro check, follow up on pending issues that the day nurse did not complete, blood return, check on my chemo, documenting my findings. At around 11 to 12 midnight, I do my med pass, my Q4 neuro check, reviewing vitals, checking my IVs, my drains, my blood returns, completing my work list, documenting my findings, charting my INOs. 1 to 3 a.m., med pass, work list check, follow up on empty orders, finish uncompleted documentation, write my notes, finish notes. At this time, I may eat if I have the time. 4 to 7 a.m., I have my med pass, my neuro check, my blood return, document INOs, collect labs for the morning, check labs, repeat electrolytes, administer platelet, red blood cells if needed, check PCAs. So that's my workflow. However, don't get it twisted. There's always random things that would go down. For example, my Q2 repositioning of patients that can't turn themselves to prevent breakdown, random PRN med pass, random orders, random EKG order, random fluid repletion, responding to individual patients when they need me, making them food, when they get hungry in the middle of the night, changing, providing pericare, changing expired wound dressing, expired peripheral dressing, expired central line dressing, random and scheduled finger sticks, comfort care or comfort measures for CMOs or end-of-life care, unforeseen things like vomiting, nausea, diarrhea, chest pain, shortness of breath, chemo reaction, blood reaction, etc. Responding to emergencies, helping out coworkers, watching the telemetry monitor, responding to anomalies. Don't forget about admissions, new orders for the new admitted patients, needs for the new patient. New admission can be really challenging and can be really busy because now you have to balance your current patient needs and add a new work list for the new patient. The doctors may forget to put in orders, or you need orders for the patient. New patient could be really sick. It can take up all your time. It definitely can be busy, chaotic most of the time. Oncology nursing is very rewarding. You get to exemplify your compassion. You get to know patients and their families. Whether the outcome is bad or good, you are there to support them. You will remember the worst outcome. At the same time, you will enjoy and celebrate and appreciate small things.